again. Hey,
Hello.
girl, how are you?
Hi, good, thank you. Yeah.
We have today a nice and very interesting topic, right? Testosterone level in guys.
Yeah, testosterone. It's quite the hot topic
Mhm.
these days for men.
Let me ask you, what is basically same sign or symptoms of having low testosterone?
So
I know.
yeah, well, I mean there are symptoms that are very well known that most people would think about. So for men, low libido, possibly low energy, inability to maintain muscle mass or build
Mhm.
muscle mass. But there are other symptoms that people often don't realize can be due to low testosterone, and that's
Mhm.
mood disturbances. So
Oh, I see.
anxiety, irritability, a
Mhm.
lot of symptoms that people would associate with sort of PMS or menopause in
Mhm,
women,
mhm, mhm.
insomnia, these
Mhm.
types of things.
So it's like kind of like andropause for men.
Andropause for men, so
Okay.
yeah, menopause being
Menopause,
meno for
mhm.
women, and andro
Mhm.
being men for male for
Mhm.
men. And
Okay.
other symptoms, actually, even more obscure, are inability to heal properly.
Mhm.
So often, the integrity of the connective tissue or the skin,
Mhm.
increased pain levels,
Mhm.
so pain sensitivity
So you have higher?
with lower testosterone.
Mm-hmm. So you have higher.
Sorry?
Well, you feel pain more when you have low
Yes, yeah.
testosterone.
Your pain
Really? I didn't
tolerance
know
is
that.
lower. Yeah.
Oh, man.
So testosterone is actually a really, really, really important hormone. for
Actually,
men.
I don't know. I did because as coach, I have to do those
Yeah.
research. Actually, I don't know what is more danger. Actually, if having high testosterone or low testosterone. You know what I mean?
Well, having high testosterone, it's not so much high testosterone, it's what the testosterone is doing in the body. So
Mhm.
if the male is converting the testosterone
Too much to estrogen, right? Or DHT.
into estrogen or DHT,
Mhm.
which is caused by things like inflammation in the
Mhm.
body,
Mhm.
then that's when it's a problem. So,
Okay.
so just giving testosterone, for example,
Mhm.
isn't necessarily the solution.
Mhm.
The reason why
Mhm.
somebody might be low testosterone is not just because they're not producing it,
Mm-hmm.
right? They actually might be producing enough testosterone, but that testosterone is being converted into other
Mhm.
things. Yeah.
I know one tip, for other guys, when, if you can grab here, fat here or here on handles,
Yeah.
if you pass 40, you
Yeah.
probably have low testosterone,
Yep.
So, now,
weight gain around the middle for sure.
okay, so what is basically treatment for this problem?
Well, actually, from a naturopathic perspective, we don't go straight to testosterone replacement. There are some people
Actually,
that
that's
might.
very good because
Yeah.
it's the fixing problem.
Yes, it's
because
not
your body
fixing the
even
problem.
produce less testosterone,
Yes,
right?
yeah, you can actually, if you just take testosterone on its own, and the issue isn't actually testosterone production,
Mhm.
it's conversion, then you can
Mhm.
actually increase risk of other diseases,
Mhm.
and you can increase estrogen in the body because
Mhm.
that
For
testosterone
sure.
might be converting
Converted.
itself into
Mhm.
estrogen, and then you also might repress or suppress endogenous testosterone production.
Oh, I see.
Right? So then
I
you're
see.
dependent
So then you have to take
on-
it for forever.
Yeah,
So,
so we don't want to do
for
that.
example, for people who's already like 50, 60, have super low testosterone, they probably have to first try some both like
Yeah,
natural
so
way.
I mean, of course, I would always do testing. I would test
Mhm.
all of the hormones.
Okay, that's good.
Yeah,
Actually,
yeah.
good thing. So basically, how it works? What is the first step? Basically, somebody come see you, and basically you make like
Yeah.
blood work, like you check your hormonal.
Yeah, so the basic blood work, I would do a full screening, not just hormones, but also
Mhm.
liver, kidney,
Mhm.
cardiovascular, fasting blood sugar, lipids,
Mhm.
because I want to see if there's any inflammation in the body.
Oh, I see.
Right, and I also want
Mhm.
to see, okay, is the testosterone levels might be low, but where are the estrogen levels, right?
I see.
Right, so
Mhm.
that's like basic blood screening. You can get a lot of that through your MD as well,
Mhm.
and then I like to do usually do advanced testing in the urine as well, so
Mhm.
to test urine metabolites to see,
Mhm.
well, how are the hormones being converted
Mhm.
in the liver, right? So the
Mhm.
liver is a really important organ for hormones
Sure.
in the body. Yeah.
Mhm.
So that's first step, and then
Alright.
then we actually find out, is there actually
Okay, and let's say you find
low
out
levels.
somebody have very low testosterone.
So the current ranges that you would see on a life lab sample, like
Mhm.
here, I can't remember the exact numbers off the top of my
Mhm.
head here, but it won't say you're low
Mhm.
according to conventional ranges
Oh, okay.
compared to what I look at, right?
Because
So I'm looking at age
you know what I'm gonna
range,
say, because I'm not saying
Yeah.
maybe some maybe doctor says, okay, when you see result, it's good, you're normal, but you still have like problem with sleep,
Yeah.
mood, and
Often,
tired.
often a person is suboptimal for age.
Mhm. Oh, okay.
Right, so it depends what age the person is
Mhm.
at. Definitely, as you age, the levels will go down
Mhm.
gradually. But what we're seeing is more and more and more early andropause. So
Mhm.
men having lower and lower testosterone at earlier ages, and sometimes really low testosterone in late 20s and early 30s. Yeah.
Okay, why is that? Why?
Well,
Is it food?
yeah. So there's
Chemicals?
many reasons. Many reasons. So so there's a lot of xenoestrogens in the environment. So these are
yeah.
plastics,
Mhm.
right?
Mhm.
So plastic water bottles, plastic packaging, plastic
Mhm.
everything, pesticides. These all
Pesticide.
imitate
Mhm.
hormones, right?
Mhm.
So this can actually cause low testosterone in the body. So toxicity, liver problems. So any kind of toxicity that affects the liver, whether it's self-induced,
Mhm. Mhm.
substance abuse or
Oh, okay.
alcohol or anything
Mhm.
like that, or it's just stuff affecting the liver in the diet, right?
Mhm.
Not getting enough vitamins and minerals to support the liver, support the hormones.
I know in the States, it's like 80% have like low testosterone guys. Like, it's
Yeah.
crazy.
So the big reason, I didn't say the big reason yet. The big reason is inflammation
Oh, okay.
and weight
Mhm.
gain. So fat
Mhm.
actually turns in the presence of inflammation. It's not just
Mhm.
ordinary fat, but just fat in the presence of inflammation, particularly
Mhm.
abdominal fat.
Oh, okay.
Will turn
Mhm.
testosterone into
Mhm.
estrogen. It's a
Oh, I
estrogen
see.
producing
Mhm.
factory.
Mhm.
So when men particularly have what we call poor glycemic control,
Mhm.
which is blood sugar problems
Yeah.
and inflammation. So you start getting high cholesterol, high blood sugar. You start getting all those cardiovascular problems starting to emerge. That is the big cause, I
Mhm.
think. You combine that with the toxicity and the liver issues, and
Mhm.
so it's not necessarily just. That's why I say it's not just production. It's not just a matter of putting more in.
Mhm.
It's fixing why
Well,
the
you
testosterone
have it.
is.
Okay,
Yeah.
good. Okay, and now let's talk about how basically naturally increase or boost testosterone. Let's
Yeah.
start with food. How I can increase my testosterone by eating
So
habits?
a healthy, whole food, low glycemic diet,
Mhm.
right? So taking things out that are causing inflammation, finding out if you have, things that are causing inflammation, like food sensitivities, but primarily low glycemic. So really focusing on making sure that your blood sugar is stable and that you're eating clean. So clean sources of meat, clean, non-pesticide containing fruits and vegetables.
Can I have
things
sugar,
like that.
for example? I like sugar.
Sugar is like saying, give me low testosterone.
Right.
Right?
No, I
It's
know.
like saying
It's crazy.
Every
I
time
know.
you eat sugar, it's definitely
Is it-
using up your testosterone in an indirect
Mhm.
way. Yeah.
What about what kind of food I should avoid?
Well, again,
How do you say sugar? What else?
sugar. Well, it's not just sugar. It's
Mhm.
anything that's high glycemic.
Mhm.
So people particularly don't realize that a lot, like fruit juices and things that they think are healthy.
Mhm.
Cereals, breakfast cereals. Like there's a lot of things that are high
Toast
glycemic.
and Nutella, right?
Toast, Nutella. Yeah, definitely. So it's just that's a real hormone killer.
Mhm.
Real hormone killer. Yeah.
Okay, so just
Yeah.
food. How I can increase my testosterone with, for example, can I use some vitamins, minerals, or herb?
I mean, there are lots of different herbs. I mean, the thing is there are herbs that will increase testosterone. Again, what I would first go to is the cause. So I would first
Mhm.
try to treat the whole hormonal system, right? The adrenal
Okay.
glands,
Mhm.
reduce inflammation, heal the gut, support the liver. All of that's going to support testosterone. Then you've got herbs like maca,
Oh, okay.
damiana. You've got herbs that will increase testosterone. But again, they're not going to do anything
If you don't
if you're
fix your
not
problem.
if you're not addressing the problem, right?
Gotcha.
Yeah. So, but I mean, one of the biggest ways to reduce your fat and glycemic load
Mhm.
is exercise, which you know all about.
Mhm.
So actually, that's a big component, particularly for men.
Mhm.
Staying active, because that is proven to reduce blood sugar, reduce cholesterol,
Mhm.
all those things, right? So you have to be you know, you can do all you want with diet and vitamins, but if you're not active,
yes,
you know,
got it.
you're not gonna get very far.
So let's talk about hormonal replacement therapy. So when you recommend that you should, like, somebody should start, you know?
Well,
go for it?
once all of the factors that we already talked about are addressed, then we can actually go into, does somebody actually need hormone replacement? So in British Columbia, naturopathic doctors like myself can't actually prescribe testosterone or DHEA. They're federally regulated substances, but MDs can. And so usually I will make a referral to an MD.
To family doctor?
To a family doctor who may specialize in hormone replacement with a recommendation, you know, for hormone replacement. And then it's up to the individual and the doctor to decide what's the best route to take. I certainly know about testosterone prescribing, and I can support, you know, I can still support peripherally with that prescription.
Okay.
However, before going to that, especially if a man is younger, we can often go, like I said before, instead of going straight to the testosterone, which could
suppress your natural testosterone.
Yeah, the
right?
natural testosterone is to do HCG, which is human chorionic gonadotropin.
Yeah, so basically the hormone which produce placenta, right?
Yes,
Within,
and it actually just encourages the natural production of testosterone in the body. Even if somebody is getting testosterone replacement, we often put them on that to prevent the body from suppressing the natural testosterone. So
basically
you take it with testosterone.
Okay.
Yeah.
Are you to like taking it like constantly or sometimes or?
It's taken ongoing while on testosterone replacement.
Oh, I see.
Yeah.
I see.
We also prescribe generally an aromatase inhibitor, which is a substance that stops the body from converting testosterone into estrogen. Right. So which is really recommended most of the time when prescribing testosterone.
So basically, somebody's on hormone replacement therapy should use HCG and then some aromas inhibitors as well.
Yeah. Yes. Yeah. So HCG, aromatase inhibitor, and testosterone. Now this is all assuming men, right? We've talked about men. Women sometimes need testosterone replacement. And both men and women can sometimes use what's called DHEA, and DHEA is a
precursor, basically, right?
Yeah, precursor molecule to testosterone. So we often give DHEA to women before we would go to testosterone.
You can buy it in Canada. You can ship from States.
You can buy it over the counter in the US. Yeah, it's
in
a prescription.
States you can buy everything.
Yeah, it's prescription in.
Is it prescription? Because I bought in States in GMC.
Yeah, it's actually federally regulated here, so I can't even prescribe it here. But again, an MD can prescribe it, and I can also make a recommendation.
And what about somebody taking, but these are precursor, like hormone precursor. You never know if your body convert to testosterone, to estrogen, to DHT, progesterone. How you use or how you avoid?
Well, once you're on any kind of hormone replacement, you're wanting to get retested, right? So whether we do it in the blood or the urine, depending on the style of the doctor that you're seeing, at the 3 to 6 month mark of replacement, depending on the results that the person is getting. Then you're going to definitely retest. Just to make sure that everything is going as planned in the body, right?
Okay.
Yeah, you don't want to be converting too much testosterone into estrogen.
Okay, gotcha. And my next question, somebody using HCG. I heard a lot of people using as diet, like for dieting, right? For lose body fat.
Yeah, so there's an extreme HCG protocol. So it's generally an injection, and I think it can be taken orally, but mostly we do injection, and it's involves doing there's actually multiple ways of doing it, but the classic way is doing a very caloric restricted diet and taking the HCG. So really tricking your body into losing fat quickly.
It works.
It does work, but if the person does not stick to some kind of follow-up diet plan for several months after.
That's mostly for female or for male?
Both
Okay,
can do it.
but originally HCG is like have to increase chance of you get pregnant, right?
HCG is a sign that you're pregnant. Yeah,
oh, you sign you're pregnant,
it's
right?
It's a
sign.
pregnancy test.
Yeah. That's right. You know.
Yeah,
so what about you? When some woman taking HCG, she can get pregnant easily or not? Does not work.
No, I don't think it has anything to do with that.
So it's good.
Yeah. It's mainly just for for dieting purposes, but again, like I say, it's not. It can be used as a quick fix, but there's still a long-term commitment involved to keeping that weight off. I've seen a lot of people do the HCG and then they're done and they go back to normal and they gain it back again, which is very classic with many types of diets, right? So people are always looking for that quick fix. Again, this is why it's important.
It's no easy way.
Some people they need, like, this is why people come to people like me or there's people like you. It's somebody to help guide you and keep you on track, because it's kind of easy to do things for 3 weeks, but when it involves a 6 months to a year to fully change the way you live and change the way you eat and change the way you exercise and all those things, you do need support. I know I need support. Some people are really good at changing their habits. Most people aren't.
Yeah.
This is my job. This is my job. It's just
jobs, right?
just changing people, helping people change their habits. We often know what to do. We know what to do to keep healthy. And
but I generally like naturopath because I don't like it first thing, but I don't like take like a medication like first step. I always like to try by diet, because many disease, not just low testosterone, you can definitely treat by improve eating habits and supplements, right?
Yep, so much can be done through lifestyle.
So how you get assessment with you guys?
So I mean, it's just like most naturopathic offices here. We just do an initial health assessment or intake, and we see what symptoms might be related to low testosterone, and recommend the appropriate lab testing if that's what's needed.
Which is the first step, right?
Usually first step, before starting any treatment. Basic recommendations around food and lifestyle for both men and women when it comes to testosterone. If somebody's tired and has no stamina, or they can't maintain muscle mass, I mean, it's fairly evident that they have a testosterone issue. So there are many things that you can do without testing. But if we're getting into any kind of herbal recommendations or hormone replacement, then for sure we'll need testing. Yeah. So.
Okay. Thank you so much for today. See you guys next time.
Thank you.
Thank you so much.